Okay.
All right. Hi, my name is Kacy Buddin. Today I'll be discussing my Carolina Health Informatics Program internship with Duke University Health System. Today I'll begin with an introduction of my internship, my mentor, and what I've hoped to learn from the experience. I will then give an overview of clinical decision support tools and how they're utilized in healthcare, specifically in the operating room. And I will then discuss about my project that I've been part of during my internship and the knowledge I've gained from the entire experience. This semester, I was able to do my internship at Duke University with Chelsea Armitage. Chelsea is a nursing information system specialist and an EPIC Maestro Care principal trainer for Optime, anesthesia, and stork. Overall, I wanted to look into how do we ensure that the EHR environments healthcare workers use every day are built in the most efficient way for those workers. What clinical decision support tools can be utilized to aid end users, and what is the process of building and enhancing these tools to benefit end users? So what are clinical decision support tools, or CDS? These tools include any health IT system, workflow, or process that is intended to deliver the right information, whether this be evidence guidance or response to a clinical need, to the right people, which can be the entire care team, including the patient, or a specific group of people, such as nurses, through the right channels. This information can be given through the EHR, mobile device, patient portal, in the right intervention formats. How is this information provided to the user? Are they familiar with the format? Can they use it easily? At the right points of time in the workflow. This ensures that the tools are utilized at the right point for the appropriate decision-making and action that's required. Once all 5 rights of CDS tools have been met, they can have a major impact on quality of care. They can enhance health outcomes, help healthcare providers avoid errors and adverse events, and improve efficiency, cost benefit, and provider patient satisfaction. There are several types of CDS tools that can be utilized in the EHR. Active alerts interrupt the workflow and direct the clinician that information must be reviewed prior to continuing. These are also known as best practice alerts, or quote unquote hard stops. Some examples of these might include a pop-up window indicating that the side you chose for positioning of a patient might not match the laterality that was put into the surgical case posting. This can also include areas that must be completed before moving on to the next part of the chart, such as the correct count indicator shown on the right here. Is the surgical count correct before we close this patient up? Hard stops are just what they sound like. They're a stop sign in the workflow that requires attention before we can move on to the next part. Active alerts are often used less than the other 2 types of alerts I'll discuss, because they can tend to cause alarm and alert fatigue among staff. In comparison to active alerts that require the user to stop and pay attention, passive alerts provide situational awareness without interrupting the current workflow. Think of an active alert as your stop sign and a passive alert as your yield sign. These can include use of symbols or color changes that just bring an attention to the user without actually stopping the flow of their work. Examples of these can be seen on the right. They're both indicators of a latex allergy. They're just shown in different ways. The top is a symbol with a hand and exclamation point showing that the patient has a latex allergy. And at the bottom, it's highlighted in yellow to bring attention to the user. The third type of CDS tools that are typically used in EHRs is clinically relevant resource information. There are 2 types. There can be external or internal in nature. External forms of these tools include links to external websites that can provide additional information, such as surgical procedures or medication information, or EPIC charting tips. In the image below, this is the educational learning dashboard that all providers can see in their chart. And it gives just an overview of different links they can click on to navigate to an external website that will help give them additional guidance through patient care. Another example of this external website guidance is Lexicomp, which is linked in the actual medication record. So at the point of giving a medication, you can easily click on this link and see information about the medication or IV compatibility of that medication, but while you're giving it, at the point of giving the medication. The second type of clinically relevant resource information is the internal type. This is a broader spectrum of guides in documentation that's included in the EHR system itself. These can include documentation templates such as timeout templates, which I will discuss in the next slide, to missing information alerts, and additional information that can assist end users with documentation and patient care. A great example of internal information is the dressing descriptions seen on the right here. These descriptions are provided because dressings are called different things at different facilities. In a world where a majority of the nursing staff are newer, or they're in some places entirely made up of travel staff, tools like these are important aids in documentation and patient care because it gives a facility-specific name to something that they might not be aware of. As mentioned before, one of these types of internal tools utilized are documentation templates. One of the most important and most recognized of these are timeouts. Timeouts are a standardized check-in created by the Joint Commission, the Federal Regulation Council over Healthcare Facilities, and the World Health Organization to confirm that the correct patient, the correct procedure, and the correct site are confirmed prior to any procedure. These timeouts are always include at least those three checks: the patient, procedure, and site, but they're often modified to fit each facility's policies and specific procedures. Timeouts are a universally known and understood construct in the operating room. OR staff don't start any procedure without performing one, and they're aware that it needs to be done. On the right is a current pre-procedure timeout that is performed and documented at Duke University. These certain types of timeouts, such as this one, are legally required to be documented in the chart for a procedure. But there are others that just act as guides and checklists for procedures that are not legally required. From here, I will discuss the development of a new CDS tool for the operating room and the project I was part of during this internship. For this project, it was brought to our attention that the operating room staff lack a uniform method for documenting the administration of chemotherapy medication in the operating room. Our solution was to create a specialized timeout documentation template that will guide end users through chemotherapy medication checklist and promote safety amongst staff and patients. Since timeouts are so widely used in the operating room and so widely known, we felt that this would be the best tool to use to provide guidance through nurses as well as promote compliance in the documentation. Here's a timeline of developing this tool. We started by meeting with operating room staff that felt that there was a lack of a method to document chemotherapy administration. In this meeting, we established what it is currently in place, or better yet, what is not in place in this case, and what guidelines they would like to implement. The next few development meetings included meetings with stakeholders, OR staff, OR managers, analysts who build the template, and policy and regulation councils throughout Duke University to make sure everybody's on the same page and that we're meeting all the needs. Using this information, analysts were able to use previously used timeout templates to create a chemotherapy administration timeout template. And from there, it was put into testing. Education tip sheets were given to Epic super users for each surgical area, and it officially went live. The star indicates kind of the process of where we are right now. From here, evaluations of this tool will be performed to see if it's being utilized by the nurses. If it's easy to use, are they satisfied with what they have? Are there any barriers to them documenting? And are we accurately able to measure compliance? Using the standard timeout template, analysts were able to create and add additional information in order to create a new timeout. At the right is the mock-up for the new timeout that was created during the development of this testing process. This included things like packaging of the medication being intact, verification of the appearance of the medication. Was it cloudy? Is it clear? Verification of the actual medication and dosage. Protective are the people that will be administering this chemotherapy, are they wearing their protective gear? And better yet, and overall, was the medication documented in the MAR? Looking back at the 5 rights of CDS tools, we can evaluate if this tool is an effective tool and can help establish if there's any limitations or improvements that need to be done. Are we giving the right information to the right people? Are we providing guidelines? We are providing guidelines in compliance to Duke policies to nurses who are administering chemotherapy in the surgical field. Is it through the right channels in the right intervention formats at the right points in the workflow? This timeout is provided through an intraoperative surgical log for a specific patient in a format that a nurse is already familiar with while they are actively performing patient care. From here, we can look at the limitations of this tool. When evaluating this tool, there are 3 limitations, major limitations that can be approved upon. The first is compliance. Since this timeout is not required in the administration of the medication, there's no probable chance that there is a probable chance that nurses might not complete it. This can in fact impact our second limitation, is the fact that we can't run a report on this timeout yet. A way to report on this timeout has not been created, and it would be inaccurate to report on something that might not be utilized 100% by the staff administering the medication. The third limitation is the lack of workflow integration. There's currently no link between ordering chemo medication and the requirement or the initiation of a timeout in the operating room. Without a link between those 2 workflows, it's hard to track whether the medication that was even administered and who administered it and where, based on the chemotherapy medication being ordered by the physician. A lot of limitations would be improved if this timeout was made, a requirement based on the medication being ordered by the provider, and it being basically a hard stop before they could move on to the next part. Overall, I can't even include everything I learned during this internship experience. I was able to participate in the development of a new CDS tool that would aid nurses in the operating room. I was able to learn the impact of an EHR design and CDS tools on end users, participate in meetings with and learn the importance of interprofessional perspectives on EHR build. And most importantly, I was able to learn more about good versus better build. What are ways that we can improve the build so that it meets our needs? Why create a timeout template for potentially dangerous medication if there's no way to run reports on that information that's been entered? How could we make this better? The key to this is to always keep asking, why are we doing this? And is there a better way to do this? In healthcare, charting and documentation should not be the hardest part of patient care. The HR should be designed to help end users with patient care, not increase the burden that they have to deal with every day. It was a great experience, and I am very excited to continue on with informatics from here. Thank you.